going to start off doing a very simple surface application. John, just open for me. So we're going to actually treat the biting surfaces with these 3 teeth, the 2 premolars and the molar at the back. So we select 60 seconds. And it literally is as easy as that. That is as hard as it gets. It's really the most boring dental treatment out, sadly. But it means that there's no drilling, no filling. It's sterility obtained within 30-40 seconds. Now, Jono's body has the opportunity from his saliva to remineralize those small areas of decay. And from there, it simply heals and goes away. And if we did this on a regular basis through, say, John, I'm just going to do another session. A tray system, we could plug this into a tray, pop it into Jono's mouth, walk away for 5 minutes and then come back. One of the prototypes which we're developing, Brian, is something which you haven't seen yet, is a little USB pen which goes into the back of this unit. So we sell the CMU3 at cost plus 10%. The user then buys time, clinical time through the web. So he plugs the USB into his computer, downloads time into it, plus any software upgrades which we choose to do, plugs it straight into there, and then turns it on. And that time also includes feedback on the time that it's actually run. So we can then go back to the next time that end user decides to buy more time. We can email him and say, actually, by the way, it's coming up for servicing. Please return the machine to. The servicing is all included in that overall fee. So it's an interesting sort of marketing potential.
So I'm not supposed to swallow it?
Yeah, you can do. That's it. I want you to actually lick it and get it as wet as you can. Because your saliva contains all the minerals your tooth needs to actually remineralize. And that is as difficult as dental treatment gets now.
It just feels like I had my head up the coal nut.
That's it. Now, if we were doing, say you had a small area of decay actually between teeth, this is actually much more difficult to treat conventionally, and also with the current range of ozone instrumentation. Conventionally, if you had a little hole between these two, we would actually drill a hole in both sides of those teeth. So you wind up with 2 fillings, and they look like little wedges, or often what's being referred to as the Australian trench. But you go from one tooth to the next, to the next, to the next, to the next, and then you just put a filling which extends the whole way along. Now with ozone, we can actually treat between those teeth. So let me just pop it back into function. And you literally just hold it straight between those two. Again, it's exactly the same timings. It's a very, very simple way to heal. And lastly, if you had, say, a small area of decay, an area of sensitivity along the side of this tooth, which is actually very common, and certainly that's where I was, we can just treat that with ozone. And I'm just going to use it almost like a gas wash just across that area where it just plugs into the gum tissue. You can then lick that and go off and chew ice on that tooth and you wouldn't even notice it. There you go now. That's how simple it is. And that turning off the sensitivity is 5 years minimum. Yeah.
So that what you just said now is going to last for 5 years?
Yeah. On the sensitivity, if you had sensitivity there?
No,
yes.
no, sensitive.
No, in terms of decay, you've got a window of opportunity of about 18 weeks. That's about 3 months. And your body then will stuff that full of those areas full of minerals. So that's how the reversal of decay works. And once it's remineralized, it's never ever involved in decay again.
Okay.
But that research is being done at the moment. What we're saying to practitioners is we develop a tray system. Use the tray that you bring your patient
like
back.
One of the got.
Yeah. It's got just little ports in it. We bring the patients back every 4 months, plug them straight into the system, turn it on 5 minutes, walk away. So you're cooking gently, while the system is actually working. And we can then have 4 or 5 of these all lined up. So we just have repeat business the whole time. So from a cost effectiveness for dentists, it's actually very cost effective. And it's something their hygiene team can do. Dentists don't have to spend their valuable time doing it.
That's great.